Hello, everyone. We will go on ahead and get started. Thank you all for joining us today. Super excited to have everyone in the space. I'll start. My name is Aston Georgia Williams. I use she, they pronouns. I am a program coordinator with the California LGBTQ Health and Human Services Network. Super excited to have you here today at the Let's Be Equity Webinar 2, Fighting for Discrimination and Advocating for Ourselves. This is the second webinar of a 4-part series working to assist with deepening understanding of health equity, data advocacy, and the power of inclusive health systems. Today, I'll be joined by some of my colleagues here. Y'all can give a wave. We have Isaias, the manager of programs, Ariella, our senior communications network specialist. We have Lou, our network organizer, as well as our amazing evaluator, Shannon. And all of them will be assisting today as we move through this programming. So thank you all for being here. Talk a little bit about Zoom etiquette before we jump in. We will have a Q&A session the last 15 minutes of our time together. You can ask questions anytime via chat, and we can try to get back to you. And if we don't, we can make sure that we do so at the end of the presentation. Feel free to engage with us with the content. You can take notes, reflect, ask meaningful questions. And again, any unanswered questions that we can't get to today, we will make sure to follow up with after the webinar. We'll send an email out to everyone. We'll move forward to our community agreements for today. We will have some interactive portions. We will have a video that we share. And so we just want to make sure, since everyone is in different places with learning and being together today, we want to make sure that we cultivate a brave and safe space, as safe as we can make it for today. So we wanted to share these community agreements with everyone. The community agreements that we have are honored lived experience and inclusive language, assume best intentioned, attend to impact. We may not always get it right, and harm happens, but we're committed to listening, learning, and repairing. Speak from the I, share your own experiences, avoid making any generalizations. Take space and make space today. Be mindful of how much we're speaking. We have a lot of experts in the room, and we love to hear everyone's voice. But we also want to make room for voices that are often unheard. Openness over perfection. Not everyone needs to have all the answers. We'll be doing a little bit of brainstorming today. And so what matters is that you show up and that you participate. And we want to protect confidentiality. So any personal stories that are said here, we definitely want to keep them here and respect people's right to privacy and agency. And just to remember that we're all learning, and this is a space that we can learn. So just making sure that we welcome questions, curiosity, and any growth. And then our agenda for today. So super excited to welcome you all, do a few acknowledgements before we get started. We'll be talking about language and communication. We'll be doing a Words Matter activity with Lou, which will be very exciting. And then showing a small clip of Vanessa Goes to the Doctor, just so folks can see how we can make sure our medical spaces are inclusive. And then we'll be talking a little bit about advocating in our positions. So advocating as a patient or as a healthcare provider, and then share a few resources and close and do our Q&A. So before we begin this webinar today, I just want to take a moment to acknowledge the land that we're on and honor its original stewards. I personally am joining you today from the occupied territory of the Nisenan, Miwok, and Padawan peoples, today known as the Sacramento area. I also want to acknowledge a lot of my colleagues are located in the Los Angeles area, what's known to be Los Angeles today, the land of the Tongva and Chumash people. And so I want to make sure that we're acknowledging the lands that also may not have been named today. Folks are joining from all over, so feel free to share what land that you are currently residing in if you'd like. Yeah, and just taking a moment to acknowledge the past, present, and future generations of individuals. Yeah. And also, before we get started, I want to acknowledge the moment that we're all sitting in right now. There's a lot happening in our world today, a lot of painful realities of what's happening with the ICE raids in California and across the country, the rolling back of LGBTQ rights, and just the broad climate of fear and injustice that's happening. And just wanting to appreciate y'all for being here, for wanting to learn more and how to impact your communities in the most positive way. So just wanted to acknowledge what's happening in our world today. I'll take a minute to pass it over to Isaias to talk a little bit about what we do at the California Health and Human Services Network. So Isaias, I'll go on ahead and pass it over to you.
Hi, everyone. My name is Isaias. I'm the manager of programs at the network. And a little bit about the network. We are an LGBTQ specific program of health access. We bring together more than 60 nonprofit providers, community centers, and researchers to advocate collectively for state level policies and resources that will advance LGBTQ health. The network seeks to advocate for policies advancing the health of LGBTQ plus communities, expand coverage and improve access to quality healthcare, strengthen programs and build capacity for member organizations, and increase funding to LGBTQ health and human services organizations. Next slide. And one of the programs that we are running and that is funding this training today is called the LBTQ Health Data Initiative. This initiative was launched by the California Department of Public Health to address significant health disparities affecting 2.5 million Californians who identify as LGBTQ. This program aims to tackle systemic anti-LGBTQ bias, lack of culturally responsive care, and shortage of medical services and research. It also aims to focus on the needs of LGBTQ women, trans men, non-binary, and gender non-conforming individuals, build capacity of service providers to deliver culturally and linguistically responsive care, develop and implement community-led training and technical assistance for health service providers, and strengthen the continuum of care for LGBTQ Californians. This is a 2-year project that ends on March 2026. And this is the wonderful team that is working part of this project, who are here. Many are here today. I think Danny's the only one who's not present today. But yeah, this is the wonderful team. And I will pass it on to Shannon to talk about the importance of SOGI data and health equity.
Yeah. Hi, everybody. I am Shannon Kozlovich, she, her, hers pronouns. And for those of you who do not know me, I am a research scientist who I studied tobacco and tobacco-related cancer and how menthol makes it worse. And from there, I got into doing a lot of health equity and health justice work in terms of trying to prevent our communities from entering into nicotine addiction, because it is something that leads to so many health disparities for everyone who uses tobacco, but particularly among LGBT communities because of the industry's history in how they targeted us. I could talk about that on my soapbox forever, and that is not what I'm here to talk about today. A lot of health equity work, when we talk about spaces that we walk into for seeking healthcare, whether it's because of a tobacco-related disease, because of needing to go get our standard cancer screenings, or anything that we are walking into a doctor's office for, as queer folks, we really understand the need for our physicians and our care teams to see us as the whole and complete individuals that we are, not because of or in spite of any of our identities, but really being able to see how our identities impact who we are and how we receive care, and also how the world interacts with us. So when we talk about health equity and SOGI data, we're really talking about what does it look like to have your providers collect or understand your sexual orientation and gender. particularly as it pertains to how is this noted in your medical record? How is it used once it is in your medical record? Do your physicians look at it before you walk into their office? Are you able to list your pronouns and the name that you want to be called in the office or in the waiting room, somewhere where that is easy for your providers to access and see, so that you are seen and respected in the office? And for the providers that are in the room, these are the things that we're really going to be diving into in terms of what our health systems look like and how this data is collected and how you are using it. So we're really talking about these access to care things where when someone's identity is not respected, that is a creation of a barrier to accessing care. And that really has a huge impact on how folks will enter your office, or how you as a patient will enter an office of care, or even be willing to seek care. Next slide, please. So before we get into kind of the impacts of all of this, I want to make sure that we are doing some level setting. I am a scientist, so defining terms is always where I like to start, right after a short introduction of what I'm going to be talking about. So we're going to be defining gender identity really as, or gender specifically, as a person's internal sense of being a man, a woman, neither one of those things, both, somewhere in between, or none of the above. There are a lot of terms in English that define gender because these are self-identifying terms. And when we are given the ability to go find terms that explain something that we know inherently and that we are living with inside of our own skin, we end up having a variety of terms that we come up with for this that allows us to explain ourselves better to the people around us. Gender expression is different than gender, because gender expression is how someone presents. And our society has a weird amount of like normal rules or cultural rules around what gender or sex you're supposed to be in order to wear certain types of clothing. You can still be a man and wear a dress if that is both your identity and your expression at the time, just like you can be a woman and wear pants, just like you can be non-binary and wear whatever you want and still be non-binary. Clothing and the way that someone expresses themselves with their hairstyle, makeup, jewelry, anything that you choose to put on your body as a decoration, or an example of yourself that you are having as outward expression to the world, has nothing to do with what your gender is and everything to do with how it is that you express yourself and how people express themselves. This often gets confused in medical settings when we think about the fact that there are some medical systems that actually ask providers whether or not someone's expression matches their stated gender. And that's not always a correct or acceptable assumption for any provider to be making. And then we have sex, which is a designation made by a provider at birth based on physical characteristics. And now it's being more common that this is based on chromosomes, because the coolest scientific advancement recently might be that we can determine a chromosomes of a growing fetus by testing the pregnant person's blood without having to go in and actually pull anything from the fetus at all. It's super cool. And as someone who went through other weird testing for genetics when I was pregnant, I will say it's amazing that this can be a blood test now. Sex is a societal designation that we have turned into a binary through the way that we talk about it in our systems and the way that we label things on our identity documents. Sex is not binary. Biologically, scientifically, sex is not binary. As a scientist, I will stand on that soapbox for a very long time. And then we have attraction, which is usually a definition of sexual orientation, but it really has to do with who someone is romantically or sexually drawn to, or not romantically or sexually drawn to anyone. And all of those determine attraction. So let's get into what we're here to talk about today. Next slide, please. We're here to really talk about, why does this matter for healthcare providers? And as I have run a number of projects where I have gone in and talked to healthcare providers and talked to patients about asking SOGI data and the need to like change systems to do this. And always the question is, why does it matter? And it matters because how you interact with your patients as a provider, how your front desk people interact with patients, how the janitor who is coming to empty the trash can interacts with patients in a hospital setting or an inpatient setting of any kind. This directly impacts how patients or people navigate healthcare systems, are willing to access healthcare systems, and how open and honest they are willing to be with their providers to give you all the information you need to treat your patients as whole people with everything that they have going on in their bodies. When a provider doesn't understand or respect or acknowledge someone's identity, expression, or sexual orientation, it leads to misgendering. It leads to me having to pay for pregnancy tests, which are ridiculous because I am sexually active, and no, I'm not on birth control. And no, I swear I can't get pregnant no matter how many times you test me. My girlfriend cannot get me pregnant. And so there are just a lot of things that we as queer folks have to explain over and over and over again in these healthcare settings, and it creates a barrier for us to even want to go in. Using the wrong name for someone or the wrong pronouns for someone can also be triggering because of what people face out in society on a daily basis. And the conflation of sex with gender, saying that these are the same things when they're not, means that an entire systems of our bodies get ignored, particularly for trans folks, particularly for anyone who is on a hormone replacement regimen, because there are other things that need to be considered in a healthcare setting when folks are on different types of medications. Next slide, please. So care can be impacted. We all know that it has to do with how we feel when we go in and the barriers that we face and the willing to access care. But it also comes to the way that you treat your patients can actually increase anxiety. The way that you treat your patients means that you could be denying care that folks need. For example, if you have someone who is a transmasculine individual who shows up in your office and completely, you look at them and you're like, hey, expression-wise, this person's a man. That's all I see when I look at them. You're probably not recommending the appropriate pap smears. You're probably not recommending the breast cancer screenings that your patient needs. You are very likely to be missing necessary diagnoses, questions, or tests that folks need in order to be healthy, happy, safe, and whole. And there's also a really dangerous assumption that if a patient doesn't bring up being queer of any kind, that you don't have to ask sexual orientation and gender identity questions, even if they appear in your medical record, even if they're part of a standard of care for your health system. The damage that this causes is it means that we are in the closet until we step out in your facility. We are completely unseen, and you are making the patients that are non-LGBT think that this is something that needs to be hidden and isn't something that everyone has, because every single person has a gender. whether you are cisgender or whether you are transgender, you still have a gender. You also still have a sex because it is designated based on a variety of weird medical things that our system has placed on us. And you also have a sexual orientation. Your patients who are straight and anyone who is straight or heterosexual and walks into a doctor's office, that is your sexual orientation. And so asking this of every single patient is important because every patient has a gender, every patient has a sex, and every patient has a sexual orientation. And we are going to be required to ask and both answer questions about sex until we completely get rid of our entire medical insurance infrastructure that we have in the United States. And that sucks. But we're not here to necessarily fix that so much as acknowledging that both asking and answering these questions are important in healthcare settings. So I am going to hand it over to Lou, who's going to lead us through a delightful activity that is about everything that you were just presented today.
Yeah, thanks, Shannon. So, hi, y'all. My name is Lou. I go by he, they pronoun, just in case y'all forgot. um, and yeah, a lot of what Shannon talked about is going to be touched on in this words matter activity. Just as a refresher, remember the community guidelines. This is going to involve a lot of in interaction between me and you all here. So please don't be afraid to give your thoughts and ideas, but also be mindful of the things that you do say. And we will make sure that everyone feels safe and comfortable to do so. But essentially, I'm going to go ahead and share my screen. I have a list of words here. Let me know if y'all can see the screen. Give me a thumbs up if y'all can and everything.
Gonna zoom in a little closer, Lou?
Yes, definitely. How is that? Okay, perfect. So this activity is essentially everything that Shannon talked about. A lot of the language that we do use in healthcare spaces is very gendered and has a lot of assumptions tied to these gendered terms, which can dissuade folks from wanting to enter these healthcare spaces, whether that be actually physically going into a healthcare office or even just filling out a form. This can apply to anything and everything. Language is a key component to making folks feel safe and welcomed. So here I have a list of gendered terms that is viewed on your left-hand side. And there are on your right-hand side inclusive alternatives. And I will go through each of these examples that I have listed out here. And then when we get to the bottom down here, I would like to work with y'all to make these gender terms more inclusive. When we get to that point, you are more than welcome to raise your hand and to share your ideas, or if you feel more comfortable to also write it down in the chat box. But for now, I'll go ahead and go over these gender terms to kind of lay out an example of what we're going to be doing. So right here, the gendered term is female reproductive system. And this in itself already is creating that assumption that folks that have a reproductive system are identifying as women or feminine. And in order to make this more inclusive, encompassing of all folks, and to remove that assumption, it is better to create this kind of alternative where it is saying internal reproductive system or uterus and ovaries. The same applies to male reproductive system. And instead of, creating that assumption and attaching male to the reproductive system, instead, it is much more encompassing and inclusive to discuss it in external reproductive system or penis and testes. Moving forward, there is also vagina, which I know is a very medical term, but can have an association, a negative association for some folks, as it is heavily connected to the female anatomy and like women presentation. So sometimes utilizing the word frontal or vaginal canal can be more welcoming, a more welcoming word and less triggering. Of course, with a lot of these words, even such as penis and testes, uterus and ovaries, it is always great to just check in with your patients or the people that you're working with and seeing what their preference is. Similar to, what Shannon was sharing, always checking in with people, giving them their voice back and the comfortability to share that voice is important, and rebuilding that sense of trust and comfortability, especially as a lot of trans folks and LGBT folks are coming into these spaces already with a lot of trauma and just negative experiences. So always giving them the opportunity to share what best fits their comfortability. On a similar note, breast, which is typically also associated with feminine presentation and connotations, it is better to utilize the word chest tissue or chest area. And it still encompasses, like, let's say you were to write down, like, oh, I checked their chest area or chest tissue. That already tells folks, like, okay, well, it crosses off, like, it could be someone who identifies as a woman or someone who identifies as a man in between or even outside of that. At the end of the day, it is giving a broader picture and still encompasses what it is that you're trying to get at in actual care. Similar again, female anatomy and male anatomy. Instead of creating these assumptions and attaching a gender to the actual care that you're just providing, it is better to say anatomy typically assigned female at birth or anatomy typically assigned male at birth. This again gets rid of that assumption. But yes, so now that we created a groundwork of what this can look like, what these alternative terms can be, I would love to work with you all in seeing how we can create some of these terms listed down here into more inclusive, more representative terms for folks. So for women's health, what do folks think that we can do to make this more encompassing and more representative of everyone? I will be quiet and let y'all share any ideas and give y'all a minute too. I don't mind also giving y'all some like food for thought. So I'm thinking kind of similar to like what we did up here. Removing the actual like gender term here, which is like women's and the assumption that this is only for women. Getting rid of that and instead utilizing the actual body part that we're analyzing. Instead, saying reproductive health, which I think is much more encompassing than just saying, oh, only reproductive health can be for women. When in fact, it could be for trans masculine folks, it could be for non binary folks, it could be for anyone and everyone. So this is just an example. Another example could be health for people with uterus. And this, again, is much more encompassing than I would think saying women's health. And I essentially what I did is, reflecting on some of the past ones up here and reminding ourselves like we're more so focusing on the actual care and not the gender that is attached to it or the assumed gender attached to it. And with that, we can move on to men's health. Does anyone have, like, very similar to women's health, any ideas? Some of this language
So-
might be, oh, Shannon, yeah.
Yeah, I was gonna say, Lou, I was just thinking about this because there's a variety of reasons why people who may have been born with a uterus or the capacity to have one may not currently have one anymore, but still need services that would be traditionally what our like society and health system calls right now women's health. Right. And that was in air quotes for anyone listening who isn't watching the video. So when we think about our health systems and the fact that we split things into a binary of women's health and men's health, I think that that's really taking away from the healthcare needs that a human body has, right? Because this is ignoring any intersex folks who might have secondary sexual characteristics, or for anyone not familiar with that term, expressions like things that you have in and on your body and your hormonal environment that traditionally make up the standard sexual organs that are used to determine female versus male for birth sex designation. There's a variety of different people. There's people who are born with a lot of differences in their genetics that cause differences in these types of sexual characteristics or organs and things like that. So what if we just called all of it healthcare and started treating people as whole people instead of reducing folks down to the organs that they have and like separating you into separate things based on an arbitrary gender or sex binary that doesn't really exist.
Definitely. I agree 100%. I love that.
I'm like, burn down the system and overthrow it. It'll all be fine.
That's beautiful. I love that. Does anyone have any like other ideas that might have with women's health, men's health, healthcare in general? If not, we can move on to our other gender term, which is pregnant women. What are ways that we can remove gendering and assuming from the term pregnant women? Yes, I love these. Yeah, and these are all much more encompassing than assuming that folks who are have the ability to be pregnant are women or identify as women. There are many folks who are outside of that that can be pregnant. Um, and yeah, this is fantastic. Is there any additional ones that folks may have in mind? We'll go ahead and move on. How about for pap smears for women? I think this one's a pretty, I'd say, easy one for me, but love to hear y'all's thoughts.
Hi all, this is Ari.
Yes.
Oh yeah, I just saw someone in the chat say the same. I was just gonna say pap smears, and looking ahead at the prostate exam for men, I would say just prostate exams as well.
Yep. And I know it sounds like silly to like feel like these are pretty obvious, but there are instances where a lot of folks do gender these things in healthcare facilities and healthcare environments. And it's just as like little things that really do make the difference to make folks feel more welcome. So thanks y'all for just just giving the more obvious ones out of the way too. And does anyone have any additional ones to these as well? before we move on to the next ones? If not, let's go ahead and move on to mammograms for women.
I would also loop that one in with the ones above, just like mammogram, chest checkup.
I love the chest checkup one. That actually rhymes too. Any other ideas? I think even if we wanted to be like having the same language, mammograms for women, we could say mammograms for people with chest tissue. And just as like a reminder, I think it's important to remember like to utilize the word chest over breast. As we stated up here before, as breast can be sometimes associated with more feminine attributes or associations. So utilizing chest could be more inclusive and more neutral in that sense. And of course, checking in with folks and seeing if that is a preferred preference. And then we have one here, which is the Well Woman exam. Anyone have any ideas for this? Yes, I love that. Well person exam. Overall, it's but do not quit. Even just like annual exam, it can just be as simple as that. Doesn't have to like have a association to like any certain body parts or gender. Again, these are all fantastic. Is there any additional ones to this wellness exam? Beautiful. All right. And then we'll go ahead and go on to our last one, which is breastfeeding mothers. How do we think we can change this? Mm-hmm. Amazing. We can even do nursing parent. Any additional? Okay. Well, those were ours. I also wanted to like ask y'all, how did this feel doing? Did this feel strange? Was this like something you've already done before? How do y'all feel like doing these little alternatives and these making these updates? Comfortable? I don't mean to call you out, Ray, but comfortable in like the sense that it makes you feel more comfortable, or do you feel like it promotes comfortability? Easy to- So last year for me, totally understand that. Easy to colleagues, awesome. Yeah, and I'm hoping that you all can like some of y'all can take this for folks and share this with folks who might not be aware of like how to make these alternative and more inclusive terms. I know like some of these are very obvious as we shared, but sometimes saying the obvious is what gets us to more progressive, more inclusive, and safer spaces to rebuilding trust with a lot of folks. And then you see here, there's a comment that says, I have issues with front pull, but everything else is great and easy to make the alternative. Okay. Yeah, and this is one of those cases again, like not all folks relate or feel comfortable with certain words, and it's important to checking in with folks individually to see where it is that they are comfortable with certain words. I know some folks are comfortable with utilizing that term, and others may not be. So always checking in is vital and giving folks the voice that they need. Um, but overall, I want to say thank you for participating. And just for tips for y'all to leave with from this activity, it's always remember ask for and use the patient's pronouns and preferred terms for their body parts and identity, and to use people with or individuals who constructions to center the health experience rather than assign genders. Um, and then when in doubt, always ask. It's never, harmful to ask. We're all learning, we're all growing. I myself am always learning. And that's just part of like nature and everything. So, and then of course, if you feel comfortable and feel safe to do so, advocate for some of these terms for yourself or as an ally within healthcare spaces. The more we use the language, the more it becomes used universally. It's like it just spreads, and it's like such a good thing to spread. So and then of course remembering that terms and languages are ever changing. Be open-minded and be an active listener. That is why we're here. We're here to listen to the patients and the people who are in need of care so that we can better serve them. And then I see, and Anna, you have a comment. Using someone's name can almost always be an acceptable substitute for gendered pronouns. Exactly. Beautiful. Okay. And then I'm going to go ahead and also share this with you all just so you can have on your back pocket. You don't have to utilize it every day, but it's something that you can also share with your colleagues. It's an activity that you can also do within your own spaces too, with your own friends and family, even. So, yeah, I want to thank y'all for doing this little activity with me. I appreciate y'all, and I'll pass it back over to.
Yeah, Lou, I'll take it from here. Perfect. Well, everyone, thank you so much for the interaction in the chat during that, Lou. That was such an incredibly engaging activity. I do want to say that speaking of, the times that we live in and technical difficulties that occasionally pop up, we had planned a delightful hour and a half long event for y'all today, but we understand that the registration link only went out for 1 hour of your time. So we're going to make a couple of pivots to respect your time. Anyone who wants to stay after the hour for Q&A is more than welcome. Instead of showing the full video of Vanessa Goes to the Doctor, we're going to put a link so that you can view it on your own in the chat. What this video shows is really the connection between what Lou and I were discussing and the activity, with how those changes can be made in a real world scenario, and also what kind of just a glimpse into a doctor's visit for any trans folks. And just looking at what those scenarios can look like and how you as providers can make a difference by making small shifts, and that are extremely important in everything that you do.
All righty. Yeah, I'll take over. Thanks, Shannon. And definitely check out that video. It's a really, really great video that shares all that really great information. I'll run through this really quickly on advocating as a patient in medical settings. We know generally anyone could probably say in our world that we live in that speaking up about your health, identity, or any concerns about your health can be really scary and really uncomfortable. There's medical power dynamics that are at play. People have negative past experience, fear of discrimination. So many things make it hard to speak up for yourself, especially in medical settings. We just want to let y'all know that you have rights, of course. You have rights to ask questions about your medical care and treatment. You have consent to refuse procedures that you may not want. You have the right to correct providers on your name, your pronouns, or how you describe your body, as Lou was talking about previously. You have a right to file a complaint if you experience any type of discrimination or mistreatment, and you have the right to feel like to ask what you need. I don't know if this happens to a lot of folks, but sometimes people will ask in a medical setting, like, hey, I kind of feel like this might be what's happening. Do you mind doing this? And sometimes they'll say, I don't know. Push a little bit. Like, feel free to be like, if it's not a no, yeah, well, can you tell me what is making you X out X, Y, and Z? So why do you not think that it's this? Feel free to get curious and ask some questions. It is difficult, but we do have a couple of ideas of what practicing agency could look like. Such as, can you walk me through what this procedure involves before I agree? This language doesn't feel right for me or doesn't feel respectful. Here's how I refer to my body. I heard you use this language for this body part. This is usually what I use. I need a moment before we continue. This is getting kind of a lot and I just want to take a second. Or can someone accompany me during this exam? Always having someone there can always be great. You always have the right to ask questions, to slow things down, to say yes, to say no, to say not right now, or request a different provider. Sometimes it takes a while to find somebody that is in alignment with you. So just some things to remind folks. And when facing discrimination, Ari is going to throw some really great resources in the chat of what our rights are. The ACLU of Southern California has a really awesome fact sheet that talks about the rights in California in response to the recent executive orders by Trump. And it kind of goes down the list of all the things that folks can know about, what their rights are, and what reporting looks like. Because we are able to report if folks are having experiences that do not feel good. Even though there are things that are changing, there's probably things that have changed since this fact sheet has come out. There are a lot of great resources that are updating what is happening in our world. But a few things just to think about is to make sure that you document. If you do have any points that you face discrimination, document, write down the date, time, location, names of everyone involved. note exactly what was said and keep any related paperwork, emails, messages. Hey, can you actually write in my chart that you denied me this, just to make sure it's written down? Always great. It's suggested by the ACLU that it is important to notify the state. So here on our slide, there's a couple of places that you can report. California Civil Rights Department, if it's anything regarding healthcare providers or government agency programs, the Department of Education for complaints about schools or school-based health centers, and the California Department of Managed Healthcare for complaints about insurance plans. A lot of times there's a lot of complaints around insurance and different things. And with this, it's hard because knowing that there is a report, sometimes it can be hard in the moment to make a report. It can be difficult to even have the energy to do it. But it does assist if multiple people have reported already, that maybe that things can move and people can take notice. But there's a lot that goes into reporting. It's not a light lift to report. And I just want to acknowledge that, because when you get this often, when there's lots of discrimination coming from different ways and different places, it's like, okay, I just don't really want to deal with it. So it can be really difficult to make those reports. But definitely check out the links that Ari sent in the chat. And Lou, I'll pass it back over to you really quickly and talk a little bit about finding or being a healthcare advocate.
Yeah, so a lot of this is stuff that we have touched on already. It's always important to ask instead of being assuming. And these are like just ways of like how you can be better at being an ally as a provider, and also just like outside of being a provider, just on your daily. This is very important. Never assuming folks just by their appearance, just by the way that they carry themselves, etc. And then normalizing a patient's voice. So if anything doesn't feel right, you can let me know at any point. Letting folks have that voice and being able to share what it is that they're experiencing during, the appointments or within forms, etc. Letting folks have the opportunity to share what it is that they're feeling, so that you can also grow from there, and like become a better advocate and an ally. And then being transparent. There's a lot of the times people who are within the LGBT community who identify as queer are asked questions every single day about their body, about how they live, etc. It can be very tiring. And at times, that sort of trauma and the weight of having all these questions asked follows into doctors' offices or within medical facilities in general. And being able to be transparent and saying, here's what I'm doing and why. Feel free to pause or ask questions, makes it that the folks that are being treated and being assisted are aware of like that they're not being probed at, they're not being questioned, and being asked questions that aren't pertaining to the care that they need. This is very important. And then, of course, create safer systems, advocate for inclusive intake forms, training, and accountability when harm happens. We're all growing, we're all learning. Sometimes we mess up, and that's totally okay. And being able to take accountability for that is really important, not only just for yourself, but for those outside of your circles is really important. And then here are a list of examples of like what you can use in your own day-to-day language with folks, such as how would you like me to refer you to and what pronouns you use? Are there any parts of your care today that you'd like to talk through or have more control over, and etc. I won't get into all of them because I know we're cutting short on time, but we'll go ahead and go to the next slide. And here are some resources for some folks. There are really, really great ones. So there's the GLAMA LGBT Healthcare Directory. It is essentially an online resource where you can type in what it is that you need, and find a really great healthcare provider that is encompassing and inclusive and knowledgeable on LGBTQ plus care. I use it quite often, and it's really, really great. It's free to use, and you can share it within your own resources, your own spaces, or utilize it yourself. There is also the National LGBT Cancer Network Directory. This is essentially is a online source that creates a list of healthcare directories or providers that are focused on cancer care, and kind of essentially ranks them on their commitment to creating safe and inclusive spaces for LGBTQ plus folks. Um, and I think it's a really great resource to share, to utilize within your own spaces too. There is also the HQ, Trans Health HQ. This is a one-stop shop for a lot of trans folks and TGI folks to gain access to not only medical resources, but also legal resources and just the general like social resources too. They also have another hub that is focused specifically for healthcare providers and professionals who are providing resources to TGI folks. And lastly, but not least, for this resource page, there is the Interact medical resource. Interact is a specific organization that focuses on advocacy and awareness around intersex identities and people. And there's a lot of great resources here for intersex folks on how to navigate the really tiresome system that we're in, healthcare systems that there are, and also informing healthcare providers what it is that intersex folks would like healthcare providers to know. And that. We'll go ahead on the next slide. And then we ourselves are also creating resources available to y'all soon that gets into the when and how to include SOGI data into your work and why it matters. These are still in development. I'm hoping to have them done by this week. If you would all like these, you're more than welcome to contact me directly. And I could send them your way as soon as they're finished, and you can start utilizing them on your own platforms and everything. So I'll leave that there.
Thank you so much, Lou. Appreciate that. I wanted to make sure that we had a slide up just in case y'all are interested in learning more or having more conversation with us. Our emails are found here, so feel free to take a little snapshot if you'd like to have more conversation with us about all of this great information. Again, this is only webinar 2 of 4, so we will have a couple more coming up in the second half of this year. So yeah, definitely keep an eye out. And since you all were participating today, we would love nothing more than to get your feedback. And Shannon, I can pass it over to you to talk a little bit more about this little QR code and the information.
Yeah. So what we are able to do here and present is funded by the California Department of Public Health. And in order for us to show that we are doing an amazing job with the funding that was awarded for this, we do need you to do your part and fill out this evaluation survey. For anyone who has not filled out one of our evaluation surveys for this project before, this is what is called a retrospective pre and post test, which means it will ask you a series of questions for how comfortable you are with everything that we talked about now, and then how comfortable were you before you came here. So we all know that this information was so good that you're way more, you have a stronger understanding of everything now than you did before you got here. So let us know what a great job we did. And once you finish the evaluation survey, you'll be sent over to a Get Involved survey that will not be connected to your responses to the evaluation survey. Everything that you write in and tell us about how we did is completely anonymous. Thank you.
I'll leave this up for a few minutes as we transition into our Q&A session. Feel free if folks would like to raise their hand or throw something in the chat. We'll be happy to answer some questions at this time. But I will leave this slide up for folks to be able to respond. And I believe Ari may have also threw it in the chat as well. Yes. We'll leave about 3 minutes to see if anyone has any questions as of now.
I've got a question. Not to put everyone on the spot, but Lou, is there a date for when the materials will be available that you gave a preview for?
Yes, I am hoping to have them by next week on Monday the 7th.
Ooh, so very, very soon.
Yes,
And for
extremely soon.
yeah, for everyone, if that preview is too small for you to see, just wait until these materials come out. They are top-notch, excellent, very simple and beautiful ways to see how SOGI data is appropriate to be used and how it can be used in a variety of different settings.
Thanks, Shannon.
Holding a little bit more space to see if there are any other questions that come up. Yeah. Yeah, I'm not seeing any other questions. I'm seeing some thank yous, so appreciate it so much. Again, these are our emails if you'd like to shoot us any questions. Feel free to take a screenshot or anything like that if any questions do pop up. We do appreciate you all for coming today and getting to know more about the work that we're doing, and we hope to see you at our next webinar. Thank you all so much, and we will see you next time. Take care.